everybody. Welcome to Stories in Time and Stories in Focus. I'm Ellouise Schoettler, your storyteller and host, and we have a great guest with us today that can answer or talk about some of the things she's been going through. She's a physician. She has a practice in Rockville, and I asked her to come because aren't you interested to know how physicians who see patients are handling the quarantine? And so here we have Dr. Michal Shinkle. Hi.
Hello.
I'm really glad you're here.
Oh, I'm glad I'm here too. It's good to see you, Ellouise.
Yes, and you're wearing your mask.
I'm wearing my mask because this is kind of my uniform these days, of this mask wrapped around my neck or across my face. So yeah, that's what we're doing these days. And I don't normally wear a mask. And so this has been somewhat of getting used to, of learning to cope and remember to wear it.
Right. But you have to have it for heaven's sakes. You know, do you think people are really learning that now and understanding how important it is for them to do it?
Yes.
Wear that mask.
Yeah. Well, we're mandated also to wear a mask when we're treating people. But every once in a while, I will realize that I've taken it off and where is it? Or where's another one? Anyway, so yeah, that's kind of what's going on in the world over here.
Well, good. One of the questions I wanted to ask you too, you've been in your Rockville place for a while now. How long have you been in that office?
I've been in practice for 32, going on 33 years now. So I've been in the Rockville area. This is my second office, but I've been here for quite a while. So
right. So there are a lot of differences for you in being in that area when now all of a sudden we have this virus coming in and everything is changing. What was the most startling thing that happened so far as the way you're going to do your work?
Well, I don't know if there's anything in particular that's startling. I think that it has been hard to watch how fearful people are of this virus. And some people needfully so because they're really at risk. But overall, generally, you know, watching people be fearful. I mean, other than that, we do, of course, a lot of cleaning, a lot of scrubbing, a lot of things that, and we're also seeing we're scheduling people further apart than what we used to. And of course, you know, everybody is, you know, wearing masks and those kind of things, which of course is very different. But it's not a lot different because we clean a lot anyway. Yeah. And so, but really paying attention to, you know, the fears and concerns that people have had, and so that's been a challenging one. That part of it.
Yeah, I bet. One of the things I was wondering, it was last night thinking about what did I really want to ask you about, and so that you cannot, as a chiropractor, you know, and working in this type of process that you do, you have to touch people.
Yes.
How do you get around that? I mean, you know, that you have, I mean, it's part of your work. You have to do that.
Well, I mean, you know, careful how we touch people. And like I say, I'm masked and they're masked. So, you know, that's a part of it, but we can't really get away from touching people in the work that I do. And so, but just, you know, paying attention and being a lot more careful, you know, and keeping as much of a distance as I can from them and them from me. And not only do I touch a lot, I hug a lot. And that's changed too, because, you know, because we're not hugging the way that we used to hug. So, but being a lot more careful and paying a lot more attention, but there's not any way to get away from actually being hands-on and touching people.
Well, and for your patients, the loss of the hug is something strange because that's your compassion. Yeah. Is coming through this ability to this way of touching someone in a friendly way or in an encouraging way, you know. And do you see a difference in the way the patients are feeling? Are they letting you know that they really wished you could have a big hug?
I think every once in a while I get hugged anyway, you know, and or I mean, not very much are we doing elbow bumps, you know, or anything
You
like
just
that.
have to treat the elbow. You know, you treat the elbow. Yeah.
So not anything like that, but I think there are quite a few people, quite a few patients that I have who either live alone or not really touched very much. And that's one of the big comments of that people have said is that this is the only place I come that I get touched. So that's been you know, hurtful to my heart in some ways, but also it makes me glad that, you know, I can offer that service of actually, you know, of actually touching people, because we as humans, we need to be touched. And it's you know, the long-term issue with not being touched, I think for a lot of people is you know, is really hard on them. So yeah, so that's, you know, that's one of the things. It is a little bit different of not, you know, of not hugging people or touching them, but you know, just kind of a gentle brush by or something like that, as opposed to also, you know, people often would bring their children in. So I'm seeing far less children because
For
the
sure.
parent would just
Yeah.
bring their children. I'm seeing some, but and those little people, you know, some of them aren't, you know, they're not really um, wearing masks. They're not into wearing masks, or they're really mask averse. So that's, you know, that's a little bit interesting there too. And but I keep my distance. You know, we kind of keep our distance from the little people. And that's another thing, is the spacing of people and keeping distance when you're talking to people, so that you're not in each other's face in the same way. So that's shifted.
Well, I think that is being paid attention to. I went into X-ray, big place, you know, where they usually have about 35 or 40 people in the waiting room, and they had 6 people in all the chairs, you know, they were down to 6 or so. So their whole look of the way that they set up their treatments was changing.
Yeah.
For this period of time. Are you in the second phase now?
Yes, we were in the first phase. We were really basically seeing people that were really more acute issues, and now we're in a phase where really we're fully open, really. And so, I mean, we're still making sure that we space people. So we haven't changed really very much. So so even though we're in the second phase, you know, the waiting room, we try to keep that basically almost free of people.
Yeah.
Now, some of the challenges with the way that we're doing medicine right now, though, if I need to refer someone to an orthopedist or out for an X-ray, that's taking an awful lot longer to get people in for treatment, or excuse me, evaluation and treatment, if I'm referring someone out. So that's a change.
What do you mean by that? I mean, in other words, do you have to set them up with the place they're coming to?
No, they generally will, you know, if, you know, I'll either give them a name or they already have somebody that they are working with, but it just takes a lot longer. Instead of getting them in maybe in a week or two, there, you know, sometimes it's up to, you know, 3 weeks, a month for them to get in to see someone, unless it's an emergency.
Right.
So that time's a little bit longer. So
Things are changing, aren't they? Just the whole aspect of how medicine treatments are being accepted by people, or, you know, what you have to do. What's the thing that's the most startling to you, or that you're the most comfortable with? Either one of those. How's that working?
Well, I think, you know, it's a number of things, I think, that have, like I said, that have been startling for me, and or maybe not so startling, but the combination is, again, back to just how fearful people are of this, you know, and we're all afraid of this, and I think that's and rightfully so, because you know, even those who haven't been at risk, who are high risk, who have gotten this virus, they're having problems after recovering from the virus itself. So there's an awful lot of things like that. And I think that probably, if anything, is the most surprising, because we haven't known that. We didn't know that from the very get-go, that there were going to be health issues, from heart issues to, other organ systems that aren't working, the nervous system. And so people are getting through this virus, and then on the other side, they're having multiple other problems. And so that's the biggest out of, watching people come through who've actually recovered. And so I suppose that's the most startling.
Right. I was thinking that as you were talking about it, I hadn't even heard that or thought about it so much, is that it's probably startling and fearful to the patient that they're not completely done.
Yeah.
And then, their behavior, what is it that they're more nervous or more anxious, or how does that show up?
Well, I think there's a lot of anxiety, and anxiety for people who are worried about this. But then with all the shutdowns and the quarantines, people are depressed. I'm really seeing that people who are pretty upbeat people. That's one of the things that they comment about. That they're depressed because because they're locked in, or maybe they're okay to see people, but then their friends aren't available. And so that's another thing I'm seeing with this virus, is that emotionally how people are doing, that they're just really having a hard time emotionally, a lot of people. And I think at first it was surprising because there were so many huge adjustments, and now we've kind of settled into how we're doing with this virus. And so I think that's kind of the long-term effect that I'm observing is, as maybe the fear dissipates a little bit, we're having, people who are depressed. So that's another thing that we're going to have to contend with as time goes along.
I think that I can understand part of that. I'm quarantined into my own home, in other words, because
Yeah.
I'm one of the priceless ones who's not allowed to go out because I'm 80 years old, and you're told. But it is that loss of having an opportunity to be with people. We are all adjusting. And so I found that Zoom has been tremendously helpful to people, that they can see their family. There a lot of people in senior home that they actually are setting up Zoom. And when the family calls, they set up an appointment and they have a Zoom. So that some people are aware of that. But who would ever have thought of it? I mean, it's just really so new, this whole thing.
Well, I'm not particularly quarantined, but I'm quarantined by everybody else who's quarantined. Yeah. I can't see the people who are quarantined either.
Yeah.
And Zoom really, has really helped and really been a benefit to a lot of people. But for little children who are not able to see their friends as well, that's a really big one of them having issues because they're on lockdown as well. And so we're all, no matter what, we're all quarantined somewhat.
In some way.
We're quarantined. Yes.
Right. I think that's important, and what you're saying is really important for patients to understand, that the physician is going to try to be taking care of them, especially, if they're very compassionate people, and recognize what the patient is dealing with,
Mm-hmm.
So there are just a lot of, how much longer do you think this thing is going to hang around?
I really don't know, because the science of it seems like we are bumped by many different ideas in the science of it. The herd immunity idea, the idea that that if we quarantine, then coming out on the other side. But the challenge is there's a lot about this virus, in my opinion, that we don't know. I mean, we don't know how it mutates. We don't know even if you're quarantined, that you come out on the other side and the virus has shifted. So you may have been a little exposed to it, but what you're facing now is a little bit different. So I think that there's so much unknown, and that's, I think, another reason that we're fearful, is because we don't know the end point. Flu, we have a season. We kind of know this is flu season, and then it's sort of over. But this one, we really don't know, and so I think that's some of the issues that we're faced. I think we're pretty good if we have something that goes from a certain time to a certain time. Yes. But when something is never ending, then
more days, mommy.
So, and it's no fault of the scientists. This is just very new. It's just very new. So we can't know a lot of things about it, which is a stressor in itself.
Right. There was just something that I was going to mention to you, is that it just popped through my voice. Oh, it's so I don't see a lot of people, and I distance myself and whatever. I worry about large gatherings. And then you see on television, it's very clear, or they're talking about it, that those people are not wearing masks. And so they are actually taking a chance on themselves, and they're also taking a chance on everybody else. And somehow it just is amazing, isn't it, that they don't seem to get the message. They don't seem to understand, or do they think that they, can never be touched?
Well, even with that, I mean, there's different studies about how effective masks are, and so, but we know they help somewhat. And I think also you're right that the distancing. So if we can be in places where we can have somewhat of a distance. The challenge with the mask, though, too, is a lot of times we don't clean them. So people are wearing the same dirty mask over and over and over, which probably can't be really healthy. I don't have the science of that, but I would just assume that that's not really healthy. And I think then watching people wear masks in places where they don't need to, like their cars, where they could be breathing regular air, and breathing our own air back to us. So that is I think that there are some issues with that. That if we're masked all the time, that we're there's problems. So I think people, it would be good if they could pay attention to make sure that if they're in a place where they can have that mask off, that they take that mask off too, that they're not just wearing it in a big parking lot where there's nobody around. I think you could take your mask off. I think you can take your mask off in your car if there's nobody else in there. So I think that's the thing, but we get used to wearing this mask and we forget we have it on as well. So I see that. I am seeing in the park that I walk in a lot that people are giving each other a lot more room, and there are less masks being worn in places like that are outdoor, where you're really not in a big group. So I see that as healthier. But yeah, this mask has its own issues, so.
And it's sad for me to say that shortly we're going to have to move away and say, I am so glad you came, because you really are a good talker. I mean, I know that. I've seen that, said that to you before.
Well, I am so glad that you invited me. I really am. You are such a delight, and I appreciate your humor. That helps us all.
Well, I think you have to. I've come to feel about this thing that we really have to laugh as much as we can.
Yes. Yes.
That do you see a difference with, I've seen you do it, bring people to laughter, but do you see a change in the patient that's laughing?
Well, I think people have gotten really very serious, And I mean, very serious and pretty sober. And I think that that if we can have places and have people like you who do make us laugh and who do make us chuckle and break up some of that seriousness. But I think we've gotten very serious, which is, we do need to laugh. So thank you.
Thank you. Listen, thank you so much for coming, and everybody, this is Dr. Michal Shinkle.
Well, thank you for inviting me.
Find her.
And the name is actually Michal, Michal. So I should have corrected that from the very beginning, but I'm often called Michal. So
I never knew that, and I've heard your name.
Yes, my first name is Michal.
All right, anyway. I shall never forget. Thank you. Thanks so much. It's been great.
It's been great too. Blessings, dear. Bye.
Bye.